So, if you've ever dealt with acne, chances are you've gone down that internet rabbit hole searching for natural remedies. But let's be real, what actually works? We're going to dive in and see what the clinical evidence really has to say about herbal acne treatments. It's a super common quest, right? The idea of using something from nature to that clear skin is just incredibly appealing. It makes a lot of us start looking for answers beyond the pharmacy counter. And if that's you, you are definitely not alone. This is a huge trend. Tons of people are actively seeking out what are called complementary and alternative treatments, hoping for better results and, maybe fewer side effects. Okay, here's our game plan. We're going to build a kind of pyramid of evidence. We'll start with the popular but less proven stuff, work our way up to the botanicals with the strongest science, put tea tree oil on trial in a head-to-head showdown, and then we'll get to the final clinician's verdict. So why the big search in the first place? Well, acne can be a long, drawn-out battle. Because it can stick around for so long, the hunt for treatments that are both effective and easy to tolerate is just always on. And check out this number, because it really shows why this matters so much. Around 80% of patients who use these alternative methods report seeing an improvement. That is a huge number, and it tells us that these treatments are absolutely worth a serious scientific look. But, personal success stories are one thing, and clinical evidence is something else entirely. To really understand what works, we have to sort through all the science and filter these treatments based on high-quality studies. So here's the crucial point. Natural does not automatically mean effective. They are not all created equal. We're going to separate the popular remedies from the ones that are actually proven, and we'll build a clear hierarchy based on evidence. All right, let's start at the bottom of our pyramid. These are the therapies you might have heard of, but they just don't have the strong clinical data to back them up when it comes to treating acne. So what are we talking about in this lower tier? Well, things like acupuncture, cupping therapy, and even bee venom. Now, while they're used for a lot of different conditions, their specific role in treating acne just isn't supported by rigorous studies. And the clinical takeaway here is crystal clear. The research basically concludes, and I'm quoting, "There is not sufficient evidence to support their use. Their use is not recommended." I mean, it doesn't get much more direct than that. It's an unambiguous verdict. Okay, let's move up that pyramid to the really exciting part, the herbal treatments that are showing some real promise in clinical research. These are the ones with good evidence behind them. Now, this slide is really interesting because it shows us how these botanicals actually get the job done. And it's not just one thing. Take green tea, for example. It's anti-inflammatory, antibacterial, anti-androgenic, and sebosuppressive, which is just a fancy way to say it helps control oil. And look at aloe vera. It's got powerful antibacterial and anti-inflammatory properties. This multi-pronged attack is exactly what makes them so promising. And that brings us to the very top of our pyramid, the botanical with the most robust, the most solid scientific backing for fighting acne, tea tree oil. We're about to put it on trial to see just how well it stacks up. So what makes it so special? Well, it has this awesome two-pronged attack. First, its antibacterial action goes right in and damages the cell membrane of the bacteria causing the acne. And second, its anti-inflammatory action helps calm the skin by blocking the body's own inflammatory signals, so it fights both the cause and the symptom. And this is not just a theory, okay? Clinical trials have actually demonstrated that tea tree oil is effective at reducing both types of acne, so the red, inflamed pimples and the non-inflamed blackheads and whiteheads, specifically in cases of mild to moderate acne. But how does it compare to a gold standard treatment, like 5% benzoyl peroxide? This is where it gets really fascinating. For those inflammatory, red, sore pimples, benzoyl peroxide is still more effective. But, and this is a big but, for the non-inflammatory lesions, like blackheads, tea tree oil was found to have similar effectiveness. Pretty impressive. And the comparisons don't stop there. Studies have also put it head-to-head with a common topical antibiotic, 2% erythromycin, and found that tea tree oil products have a similar level of efficacy. This really solidifies its position as a serious contender. So after looking at all the evidence, from the bottom of the pyramid all the way to the top, what's the final verdict? Let's bring it all together into one clear clinical ranking. This chart just lays it all out so perfectly. Look at the top. Tea tree oil, aloe vera, green tea, and resveratrol. They all have a level 2 evidence rating. That just means there's good quality evidence from clinical trials supporting their use. Meanwhile, you look at the treatments down at the bottom, like bee venom on acupuncture, they don't even have a rating. The hierarchy is perfectly clear. So the most important takeaway is this. If you're looking for herbal treatments that are backed by solid clinical evidence for mild to moderate acne, the science points straight to tea tree oil, green tea, aloe vera, and resveratrol. And, this all leads to a final, pretty thought-provoking question. As we learn more and more about the power of these botanicals, could they actually move from the alternative category and become the future of mainstream acne medication? It's a cool idea, and I guess only more research will tell.